distinctly remember walking out of that appointment and saying to my husband, I hope you understand, but if that is the life I am going to lead, I will not lead it.
There was pain. There was actual pain in my chest. And so I consulted many physicians about that. I was never diagnosed with UE until I came to Chicago.
Could you imagine sitting at a dinner table at Thanksgiving and not being able to eat food? Everybody's enjoying themselves, telling jokes, having fun, and you're sitting there not able to eat or scared that you might choke? Patients with esophageal problems require a multidisciplinary approach. So they need a lot of diagnostic tests, endoscopy. That's really where the GI doctor comes in. But then when we start to figure out how to treat the patient, the spectrum of what we can use can range from a behavioral medicine or psychologist all the way to a thoracic surgeon. So you really have to have a complex team to deal with complex problems.
And then I talked to Dr. Pandolfino at the time. He said, well, there is a method that we are experimenting here that has been proven to work with children, the elimination reintroduction diet. It worked immediately.
To have a surgeon who was so knowledgeable about my situation and was giving me reassurance that this was going to change my life and give me a quality of life that I had not had in 10 years was overwhelming and exciting.
The Kenneth C. Griffin Esophageal Center was really created to bring together our group, which are world experts on the esophagus. We focus not just on the clinical practice of esophagology, but also do the cutting-edge research that leads to the algorithms that help us manage these particular patients. People come from all over the world to see how we do things, to watch us do procedures, see how we analyze the diagnostics, and then come up with a care plan. So by training all of these international scholars over the years, we've really attained a reputation of taking care of the most complex patients. We were fortunate enough to get the announcement of an award called Pre-Media from the NIH, the NIDDK in specific, for $12 million. And this is a 5-year grant that's going to utilize 16 centers across the nation. Northwestern will be the primary site, where we're actually studying achalasia and esophageal motility disorders. We were recently awarded a patent called 4-dimensional high-resolution manometry. So we can actually look at the pressure-volume relationship as it pertains to how the fluid moves down the esophagus and how the muscles are pushing it through the esophagus. And we really believe that this is going to have a major impact in our ability to accurately define disease states. The other technology that we were recently awarded a patent for is something called endoscopic manometry, where we're actually able to do manometry while the patient is sleeping, very similar to the flip procedure. So the patient can actually get an accurate diagnosis without being awake and having to get a catheter thread down their nose into their stomach. So when people see that efficiency, they understand that the Northwestern medicine way is founded on relationships.
So I distinctly remember having the discussion with my surgeon about the esophagectomy. This is going to change your life. You will eat regular food again. And what a moment that was for me to recognize that this was going to be a journey.
My life is full of dinners and lunches with friends, family. And it's just makes life so much more enjoyable.
I cook all the things. I host dinner parties constantly, with great food, great wine, and it's just a delight to be able to do.
At the Digestive Health Institute, we really believe in our mission that we want to transform digestive disease into digestive health. And that model is not a model that everybody uses. There's a lot of people who focus primarily on the disease, but don't really think about the comprehensive nature of digestive diseases, where you can maybe fix the plumbing, but you really don't fix the entire patient. So really, we're very passionate about bringing this across the globe.